If you have any questions during the session, please feel free to use the chat box to ask those, and make sure that your setting in the chat box is set to all participants. And at the end of the session, we will address your questions. You are eligible for CHES continuing education credit from this session, and you can claim that by completing the evaluation at the end of this webinar. And your feedback will also be really helpful for us to improve any future trainings that we have. So welcome again to Curricular Mapping of Health Education courses with Health Education Specialist Practice Analysis 2, Competencies and Sub-competencies. And NNLM is really happy to be putting this webinar on in partnership with the National Commission for Health Education Credentialing. Before I pass it over to our guest speakers, I'll give you all a brief introduction to who you will be hearing from today. Anna Torrens-Armstrong is an associate professor at the University of South Florida in the College of Public Health, and she teaches in the MPH core and serves as the Public Health Education Concentration Lead. Her research interests include teaching, innovation, professional preparation, and community-engaged learning in public health. She serves as the principal investigator for the NCHEC Trainable Undergraduate Pipeline, a federally funded training program through NCHB HESPA, and she also leads a professional development initiative, the BOL Professional Engagement Network, or BOLPEN, and serves as the Eta Sigma Gamma Delta Kappa Chapter Faculty Advisor. She serves on the National Board for the National Commission for Health Education Credentialing and Eta Sigma Gamma. Cynthia Carlson has worked at the Washington State Department of Health for the past 5 years. She is currently deployed to the agency's COVID-19 response team. Ms. Carlson is a Senior Health Education Specialist Supervisor and is a member of the agency's academic guidance team. Members of this AGT help develop partnerships between academic institutions and the public health agency. Academic health departments collaborate on research, serve as guest lecturers, provide workforce and internship pipelines, hold advisory committee positions for new and existing academic programs, and assist with curriculum mapping to align coursework to current workforce needs. Previous to her work at the Department of Health, Ms. Carlson has worked for Virginia Polytechnic Institute and State University, Virginia Western Community College, and the University of Virginia. Carolyn Rogers, Dr. Carolyn Rogers is a university senior lecturer in the Addiction Studies Behavioral Health Department and an early stage investigator on a P20 grant between Governors State University and the University of Illinois at Chicago. Dr. Rogers currently holds a doctorate degree in public health with a focus in epidemiology, a master's degree in addiction studies and behavioral health, and a second master's degree in public health with a concentration in community health sciences. Dr. Rogers serves as a board director for the National Commission for Health Education Credentialing's Division Board for Professional Preparation and Practice. And with that, I'm going to go ahead and pass it over to Dr. Rogers, who is our first speaker for today.
I will advance the slide before we get moving. Okay. So the presenters, as was mentioned, was myself, Anna Torres-Armstrong, and Cynthia Carlson. We have no personal financial relationships with commercial interest relevant to this presentation, and so those are our disclosures for today. Learning objectives for today's webinar is first to describe the steps in conducting a complete HESPA 2 2020 curriculum mapping process. The second objective is to identify the need for curricular mapping using HESPA 2 2020 competencies and sub-competencies to create curricular improvements and changes. We will also discuss the importance of the HESPA 2 2020 model for professional preparation and practice. And lastly, we will discuss the steps involved with health department activities relating to the HESPA 2 competencies. I'm going to go through a little bit of the history, and I'm going to try to go through this pretty quickly so we can have questions for any of the participants to access later. But one of the first things that I wanted to discuss is that there have been 4 major projects to identify the competencies of health educators. The role delineation study, the competencies update project, or CUP, the health educator's job analysis, and the health education specialist practice analysis, all of which you see here in this chart. The first 2 studies were very lengthy with volunteer leadership and funded by donations and grants. So with that funding available from the publication of the competencies, the health educator job analysis was completed in under 2 years, using an online survey and a contracted vendor professional exam service. The most recent project, which is the HESPA 2015, was also completed in 2 years. So one of the things that we want you to note is that there has been a change in terminology from health educator to health education specialist. The terminology was accepted by both SOPHE and NCHEC. So that is something to keep in mind. Also, the title was changed from the job analysis to the broader term profession to be more accurate of the professional nature of the preparation for the job. The most recent HESA and HESPA were sponsored by SOPHE and NCHEC together and are committed to a 5-year cycle to re-verify the competencies required in practice to be in conference with the National Commission for Certifying Agency, or NCAA, accreditation standards, which require periodic analysis and best practices of every 5 years. Okay, so the purpose of the HESPA 2 is to describe the practice of health education specialists across work settings at entry and advanced levels, and to validate the areas of responsibility, competencies, and sub-competencies required at both practice levels. So the survey results have implications for professional preparation, for professional development, and for the certification purposes. Moving along, some of the results that that you can see here, this is our final breakdown. We came up with 8 responsibilities, and in the past there were actually 7. We now have 35 competencies and 29 entry level and 6 advanced level. There's also 193 sub-competencies, 114 entry level, and 59 advanced and 20 advanced 2-level sub-competencies, and 145 knowledge statements. Okay. So if we look at a comparison of the HESPA 25 with the HESPA, the HESPA 2015 with the HESPA 2020, what you will see is that the number of competencies and sub-competencies that HESPA 2 tried to reduce the numbers. Many of those competencies were similar, which created challenges for item writing for the exam, so that was one of the things that we noted. It also gets unwieldy for professional preparation progress to try to address 258 competencies, okay? And also the goal was to try to condense and combine some of these. And of course, we will see what the HESPA 2 research reveals. And so that is where we are right now. So what we have are the 8 areas of responsibility. As I mentioned, there were 7 in the past. Now we do have 8. So the data collection of 2018, the reports were finalized in 2019. And of course, NCHEC has revised the exam specifications based on these results, which actually began in 2019. So the results, the new framework study companion was released in 2020. And of course, the CHES and MCHES and exam changes will actually occur in 2021. So the 8 areas of responsibility are now: 1, assessment of needs and capacity; 2 is planning; 3 is implementation; 4 is evaluation and research; 5 is advocacy; 6 is communication; 7 is leadership and management; and 8 is ethics and professionalism, which is the new one that I mentioned earlier. So in comparison of the areas of responsibility, the HESPA 2 2020 also validated another new area of responsibility, the ethics and professionalism. So the competencies and sub-competencies relating to ethics were found in all 7 areas of responsibility in the HESPA 1 2015 model. Now consolidated these competencies and sub-competencies into one area responsibility, emphasizing the overarching nature and importance of ethics in health education, promotion, and practice. So area of responsibility 5 serves as a health education promotion resource person are now housed in multiple areas of responsibility in the HESPA 2 2020 model, primarily area 3 in the ethics and professionalism, and also in area 6, leadership and management, and area 7, and area 6, which is communication. Okay, so moving along, as you can see here, this is area 8, ethics and professionalism, and these are the sub-competencies that are listed underneath, and highlighted, excuse me, in yellow are the advanced 1, and in blue are advanced 2, okay? And of course, most of those advanced levels happen at the graduate and doctoral level. So moving right along, you can continue to see the rest of those sub-competencies as well. And we were just basically showing you some of the new things that have been added. Okay, so we're looking at now some of the HESPA 2 and exam questions. And what this slide provides is a percentage for each area of responsibility covered for CHAS and the NCHEC exam. So the assessment of needs and capacity covers about 17% of the CHAS exam times and 12% of NCHEC exam items. Excuse me. Planning covers about 14% of CHAS exam items and 10% for the NCHEC exam items. Implementation now covers 15% of CHAS and 9% of NCHEC exam items, whereas evaluation and research covers 12% for CHAS and 20% for NCHEC, and for advocacy, that covers 12% and 9% for CHAS and NCHEC, respectively. So communication now covers 12% of items for both CHAS and NCHEC, and leadership and management covers 6% for CHAS and 18% for NCHEC. Lastly, ethics and professionalism covers about 12% of items on the CHES exam and 10% for the NCHEC exam. And so that's a little bit of history that we wanted to provide you for HESPA 2. Now, for some of the recommendations you can see here, for the bachelor's degree, all entry-level competencies and sub-competencies, okay, are what we recommend, and these are verified knowledge items. For the master's program, all entry and advanced level competencies and sub-competencies, and again, these are all verified knowledge items. And for the doctoral programs, we recommend all entry, advanced level 1 and advanced level 2 competencies and sub-competencies. And again, these are all verified knowledge items as well. So for the HESPA 2 2020 sub-competencies, reflections of change in the workforce, some of the things that we wanted you to note is that the sub-competencies 1.3.2 determine the knowledge, attitude, belief, skills, and behaviors that impact the health and health literacy of the priority population. So these are some of the changes that we see for the sub-competencies in the workforce there. There's also 1.3.3, which is to identify the social, cultural, economic, political, and environmental factors that impact the health and or learning process of the priority population. There's also 5.1.3 to identify factors that facilitate and or hinder advocacy efforts. We also have 6.5.3, which is to use facilitation skills with large and or small groups. 6.5.4, use current and emerging communication tools and trends such as social media. 6.5.6, use digital media to engage audiences, for example, social media management tools and platforms. And 8.1.4, promote health equity. And lastly, 8.1.6, apply principles of cultural humility, inclusion, and diversity in all aspects of practice. So these are some of the HESPA 2 2020 sub-competency reflections of change in the workforce we noted. Now, getting to the mapping process, and this is what you're here for. One of the things that we want you to experience or learn or at least experience is to is how to create your course syllabi according to the HESPA 2 changes. It helps colleges and universities to map the health education courses using the HESPA 2 2020. And it also helps universities and colleges to develop programs and objectives, and also to meet accreditation standards. So a great syllabus put together using this process will do all three of those things. The mapping process is also used to identify course assignments, activities, and evaluation methods to meet the HESPA 2 2020 competencies at 3 levels. And again, we mentioned the entry level, which should be used for undergraduate, the advanced one for the master's programs, and the advanced 2 for the doctoral program. Strengthen the relationship between the areas of responsibility and course outcome. So those are all the things that the mapping process are intended to do. Now we're going to go over some of the matrices that you can use to map out your courses. The first matrix area is Area 1. This here basically is where you can put your course title to the left of the matrix, and then you can map out the course based on the competencies and the sub-competencies for Area 1 using the entry or the advanced level. And if you see here, you can just mark whether or not those sub-competencies are having a major emphasis where you would put the code 2, a minor emphasis where you would put the code 1, or no emphasis at all, you would put 0. And that's how you would actually map that out for the Area 1 responsibility in terms of your course syllabi. For Matrix 2, same thing. You would be doing this for planning. And again, you would look at your course and your course objectives to determine what sub-competencies are actually being met based on your course objectives and your assignments. And you would then, of course, go with whether or not you're going to use 2, 1, or 0. 2 for major emphasis, 1 for some emphasis, and for some emphasis, and 0 for no emphasis at all. Matrix Area 3, same thing, except you will be doing that for Area 3, which would be implementation and looking at those sub-competencies. Matrix Area 4, you would be looking at Area 4 responsibilities, which are evaluation and research. And again, you would be looking at which sub-competencies you're meeting and whether or not they are having a major or no emphasis at all. And for Matrix Area 5, this here, you're specifically looking at Advanced 2 level. So this, again, will only apply to those instructors that are teaching at the doctoral level. Matrix Area 5, again, you have entry level and advanced ones. So these are for those instructors or professors that teach at the undergraduate and graduate level, mainly the master's level. And so you would actually be using some of those sub-competencies to determine whether or not you have major or no emphasis at all. Matrix Area 5, again, entry and advanced level 1 and advanced level 2. So this goes from the undergraduate all the way to the doctoral program. And you would, again, be looking at your syllabi or course objectives to determine whether or not you are meeting some of these sub-competencies for the communication responsibility. And for areas of responsibility and competencies, matrix at matrix level 7, leadership and management. Here, again, you have the entry level and the sub-competencies, and you also have advanced level 1 and advanced level 2. So this will, again, apply to all that are teaching at the undergraduate all the way through to the doctoral program. And again, using whether or not you have major or minor emphasis with these sub-competencies. Matrix Area 8, the new one, which is ethics and professionalism. This will run from also the entry all the way into the advanced level 2. So again, anyone teaching at the undergraduate all the way through the doctoral level, this would apply to you. And you would then add those up and determine whether or not what your course total is. And here we have a max for the entry level at 26 and a max for the advanced and advanced level 2 at 14. Then we get to the analysis sheet. The analysis sheet is where you basically take all of the areas where you have actually added those sub-competencies up. You would put them on this sheet, and then you can actually see what areas are actually being met for specific courses, and you can also add up the totals. And here you can see it, it's very small on my screen, so I'm sure it's very small on yours as well. But all of the totals are actually added up according to each competency. Okay, so we've added all the competencies there in terms of area 1, 2, 3, 4, 5, and so on. And in here, they're combined according to the competency and sub-competency here. Now we get into some of the departments and program engagement topics that we're actually going to touch on for NCHEC and why and how this actually works within each department. One is to involve all faculty. All faculty members should be involved, especially for the courses that they're specifically teaching, because they'll be the ones responsible for telling you what applies in terms of competencies and sub-competencies. Also, to identify all courses making a contribution to the areas of responsibility. It should also be used to have each faculty member complete a competency matrix, which makes it easier for your department. Consolidate all responses, and faculty and program review consolidated matrix. And it also is to make necessary adaptations to courses. So this is a great way to work with your department to make sure that you are meeting the HESPA 2 requirements. Now I'm going to get into how we actually have mapped out our courses at Governor State. I'm only going to go over the ones that I've mapped out because there are other speakers here and we're already running into almost 30 minutes. So at Governor State, our program is currently under program review again, but we do have some things set in place. One of the things is the mapping process that's used to propose curriculum changes to align the HESPA, which we have actually done, to align with HESPA 2, I should say. All of our faculty have been involved in the curriculum alignment. Our faculty have identified and completed our competency matrix per course that we teach. And of course, there's been a faculty overview and a review and consensus. So the ones that I teach, I complete, and then I pass it along to my faculty members so that they can actually agree or disagree with what I've chosen for the matrix. Also, there's course surveillance and updates, which we all do. We try to do this at a yearly basis according to changes that are occurring. So an example of our undergraduate application program, we currently have 60 credit hours for core and concentration. There are actually 28 core hours, which includes 1 hour of practicum seminar, 3 hours of practicum internship, which include 1 health promotion concentration, which are 32-hour concentration classes. We have 2 which are foundations of substance abuse concentrations. There are 24-hour concentration classes and 8 suggested electives that students can choose from. And of course, 3, we have a pre-health profession concentration for students who plan to go into occupational therapy and things like that. And their classes vary depending on which program they would like to go into. So here's an example of a syllabus with target competencies. As you can see here, I've only honed into the course, the expected outcomes, and I've actually highlighted the NCHEC competencies that are actually covered, which you can see laid out there. And so that's how I keep track of what competencies are actually covered and actually identified in my syllabi, which were included for the students to view as well. So one of the examples that I've used for the curriculum mapping process, I have 3 courses listed here, which are which is a contemporary health issues class. Some people would also call that a consumer health class. And as you can see, I have the competencies listed out there for that particular course in their entry level, because this is all undergraduate. I also have listed for the environmental and for epidemiology. And you can see where there's major emphasis and minor emphasis or no emphasis at all for those specific sub-competencies. Notice that none of the advanced levels are completed because this is undergraduate. For example 2, I use the area responsibility and competency matrix for area 5, which is evaluation research. That was only done for the epidemiology course, and you can see where there's minor emphasis because that is a foundation course. And then for example 3, you can see where I use the analysis sheet for the area of responsibilities, and this kind of gives you an overview of how things were added up for that area of responsibility along with the competency that's listed and the numbers that were actually met with for the sub-competencies listed under that competency. So that was done for the contemporary health issues class, the environmental health class, and for the epidemiology class that I teach. And you can see here what areas of responsibility they need, what competency, and what and how many sub-competencies are actually touched there, and the total to the side, and at the very bottom, accumulation of the entire total, okay? And I will now pass it along to, I believe this is Anna speaking next?
Yes.
Okay.
Thank you, Carolyn. Okay, so moving along, I am going to share our example at University of South Florida. We have a Master's of Public Health with a health education concentration. And I want to start with a little bit of background about our process because we started this at the beginning of COVID. And we also noticed a downturn in our enrollment across several related concentrations. So we have health education and social marketing and a maternal child health track. We thought this initial dip in enrollment or applications was related to COVID-19, but we had also been discussing the decision to move and realign our concentrations, merging our health education with social marketing to increase the number of skills and experience our students have. We have a pretty broad faculty. So we're moving on that process. In addition, because of these three concentrations that we have quite a bit of overlap in our courses and other considerations in our process for mapping. So we kind of, this is what I mean when I say conducting our curriculum mapping went from complicated to complex. So our primary objective as we started to go through our process was really prior to realigning into a new concentration was to conduct our curricular mapping to align with HESPA 2020. And in doing so, we really are starting by focusing on our health education courses first, and then assessing any other areas that contribute, any other courses that contribute to the areas of responsibility, and assess really using the same mapping process, those courses, and look at where there's overlap and kind of help refine everything that we have before we merge into one new concentration. One example is we have a program planning course that's also required by our maternal and child health concentration. So we want to know how that might impact the NCHEC competencies that the course also addresses. So we're just kind of doing this very broad mapping. This is our process, and I'll just really quickly highlight where we are. We've had some initial meetings. A really important step for us has been keeping really good communication with our appropriate stakeholders in the leadership of our college. And then we've started the mapping process for the public health education concentration courses and as well our social marketing courses. And the faculty in those two areas are doing the mapping because they teach those courses, and so they know them the best. And so the next steps that we're moving towards is really consolidating all of our feedback and reviews, and then really implementing any potential updates into the curriculum considering the new concentration that we're hoping to move forward with. So this is just an overview of I just included our core public health education concentration that in addition to their hours for our MPH core, they have to take 17 hours of health education concentration classes. And that's these courses you see here. The example I'm going to really highlight is HSC 5036, which is really a short class, and it's focused heavily on professional foundations of health education. But you'll see the other courses that are mapped as well. So if you take a look at this is that first area of responsibility, the first competencies, and then the advanced level 1 that you see in the bottom. And if you look, 5036 is the first one listed. And so in this one, you can kind of look comparatively across the different courses, but you can see where I've gone through, and for the sub-competencies, marked a 1 if it's minor emphasis. And then for this example, there's just 1-2 listed under sub-competency 1.3.4. And then at the end, I've totaled those up for that course. So this is, like I said, this is a 1 credit hour course. So it really, in this particular mapping, it is the course that hits heavily on ethics and professionalism and the historical foundations of health education. So on those newer competencies, there's quite a bit more of the number 2s that you would see. And then again, at the advanced level, while it is a master's level course, we're really not addressing those advanced level competencies in 5036, but you'll see that there's a few marked in, if you go down and look at 6505 or 6507, those particular courses are program planning and intervention methods. So we are hitting some of those advanced level competencies in this particular matrix. And then you would continue. I don't have all of the competencies here. I'm just showing you a sample. So you would go through all of the competencies, and when you're done, here's that analysis, that overall analysis sheet for the areas of responsibility. And this is really helpful because you're actually tallying up those frequencies of 1s and 2s from the competency level worksheets that you've completed, or competency level matrices, and you tally up all of those frequencies, the numbers of 1s, the numbers of 2s, and you put them on this worksheet, and then you total them on the far right column where it says course total. And it gives you this higher level perspective of where there are gaps in terms of missing, gaps in your curriculum or in your overall coursework that you're providing within the class or across the curriculum, where you might need to introduce new material, restructure the course, or add some actual skills and applied efforts so that you really have a more balanced approach. So if you look for this one, 5036, in that far right column, you can see that we had 32 overall competencies addressed. So let me advance the slide here. And here's the advanced level. So there were very few overall. Again, in that area of responsibility 8, that was that ethics and professionalism, which I said is more heavily focused on in this particular class. So you see that there are some numbers in there. So through this process overall, this is the first time I've actually participated in this, and I decided to be a little kind of practical about it and track what was really working in doing this and what made it easier, and just thinking about, time and effort, and everybody is really, right now under this pandemic, time is of the essence, right? So some of the things that I found helpful was have the faculty who teach the classes do this review if possible. And I used an actual printed copy of the syllabi for the courses that I've mapped. And I like to use what I call the out loud method, where I'm actually talking about this and keeping track of the competencies as I'm going through. So I have a copy of the competencies printed as well as my syllabus. And unless you have 2 monitors, paper and pencil with some of these matrices printed out is very helpful. I tracked time just to be able to give you an estimate of how long this actually takes. So the review process took me about an hour. Practicing on one course for the first time of doing this took me about an hour and a half from start to finish. That's including all of the matrices. And then as I got a little bit more comfortable with the process after that first run through, to complete all of the area of responsibility matrices, it took me 25 minutes. And then to complete the analysis sheets based off of those matrices, it took me about 20 minutes. So once you get a rhythm down, it's quite easy to complete these. It just helps if you have a good working knowledge of the course. And have that syllabus handy, because it does help if you taught the class. It's a good reminder of what actual assignments and work is being done, and so where the competencies are being met and what's been done in the past. And now I am going to hand off the presentation to Cynthia.
Can you hear me?
Yep.
Oh, goodness. Thank you. Appreciate that. You might be wondering why someone from a public health agency is presenting a curriculum mapping, and that's a good question. Washington State Department of Health has partnerships with academic institutions, and curriculum mapping can be a component of that academic health department, or AHD. These partnerships with academic institutions training future professionals, public health professionals, help bridge the gap between academia and practice to address the evolving complexities of public health practice, such as those that we've been experiencing with the COVID-19 pandemic. These partnerships help to increase focus on scientific inquiries, increase opportunities to collaborate on public health practice-based research, and most importantly, they need to develop and maintain a competent public health workforce. AHDs can help guide academic institutions as they develop or reassess their health education, health promotion, or public health programs. To a point, they can also align their curriculum or syllabi with the evolving needs of the public health agencies to ensure that the current workforce have the training necessary to meet the needs of hiring agencies. So this leads us to the partnership between Tacoma Community College and Washington State Department of Health. TCC has recently been accredited to offer a Bachelor of Science degree. This includes the program that I worked with a faculty member to map their curriculum, and it was for their Applied Science program in community health. And it's comprised primarily of practice-based courses. So TCC wanted to ensure graduates of their program would be eligible to sit and pass the NCHEC certification exam. As such, TCC has aligned their curriculum with the HESPA 2 results. From a hiring agency's perspective, students who are CHEST certified are highly desirable, and mapping provides a type of insurance for that academic institution, but they are producing highly skilled graduates ready to enter the workforce. And health promotion professionals often require less training and development by the agency when they come from programs that have mapped their curriculum based on the HESPA 2 areas of responsibilities, competencies, and sub-competencies. So TCC is one such program, and I want to address today. So as you see, there are 65 credit hours for the community health program. 50 of those hours are in their major core classes, and 15 are in their capstone and elective coursework. And this is pretty much what I just went through, so I'm going to skip that slide. And I'm going to focus my example on one course, their Community Health Advocacy course, which is CHP 305. Ooh, that's hard to see. I hope you can see this okay. And we mapped it to the framework. I saw this example during the HESPA 1 curriculum mapping webinar and found it very helpful, particularly working with faculty developing a new program. We used the supplementary tables that were developed by Dr. Katie Bliss and adopted her approach to mapping the courses and sub-competencies. So looking at this example, there are sub-competencies associated with the areas 5, competency areas 5 and 7 relating to the Community Health Advocacy course. We would have the faculty members complete this table for each of their own courses, and then we would take their map and use this to, there we go, and they would put in a 2, 1, or 0 based off of their determination. So they would assign a 2 if it was robustly covered. They would put in a 1 if it was briefly addressed, or a 0 if it wasn't covered. In this example, several sub-competencies were ascertained to be robustly covered. So the 2s, because it is a advocacy course, and 5 is a competency relating to advocacy, was highly robustly covered. There were a few 1s, and moving to the next slide, only 1 0. So after each of the instructors have mapped their courses, they would transfer this information to the matrices, as you've seen demonstrated earlier. So as the faculty member adds their data to the analysis sheet, they can, this type of format can expose gaps in curricula that need to be identified and revise courses according to ensure that students have the opportunity to develop the necessary skills and ability. I hope that there's the matrices. And I hope that one or more of our examples between Carolyn, Anna, or I were helpful to you. And when you think about your programs or the benefits of curriculum mapping process, if you're interested in using the competency matrices discussed earlier in the presentation, you can find them in the Competency-Based Framework for Health Education Specialists 2020, and it's available on the NCHEC website. You just click on Bookstore. It's a little on the website. This book provides a great detailed directions for using the matrices and adapting or developing curricula. For those of you interested in public health settings, it can also be used as a tool for determining where professional development might be needed. I also would like to encourage you to look at the NCHEC Ambassador Program. There are ambassadors at colleges and universities that have health promotion and health education specialist programs, and you can sign up to be an ambassador. You will receive an ambassador's kit, and in the kit, there are templates for handouts and brochures. There are also PowerPoint presentations available. Everything you need will be in there for you, so you don't have to develop anything by yourself. You are the ambassador on your campus, and you will be the person to go to find out about CHES and MCHES certifications. If you're interested, please visit NCHEC's website to learn more about the criteria or how to sign up to be an ambassador. If you have any questions, you're welcome to reach out to Dr. Rogers, Dr. Armstrong, or me, Cynthia Carlson. Our emails are attached here on the screen. And finally, please complete the short evaluation and pass the very short post-test to get your contact hours. I'm going to be turning this back over to Erin, who can wrap up the presentation.
Thanks. Yeah, and thanks so much, everyone, for those really excellent presentations. I mentioned that the network of the National Library of Medicine is hosting the National Commission for Health Education Credentialing today. We are a provider of continuing education for CHES certified individuals. And I just wanted to let you all know that in addition to today's session, you would be welcome to join us for any of our other opportunities if you're looking for more CE, or if you just happen to think that any of the titles you see listed here are of interest to you. And we do have different courses throughout the year. All of our trainings are free online. So some are live webinars, and you can see we have others that are recordings that have been kind of turned into on-demand sessions. I am teaching health statistics on the web next Thursday at the same time, so 1 week from today, and you can see some of our others that are coming up through November and December. If you want to go to our website, which is nnlm.gov, all of you registered, so you already have a username and password, and you're welcome to open up our class catalog and then filter for the courses that have CHES credit attached to them, like you see on the screen here. You can just check that little box. And if you have any questions, please feel free to contact me as well at ers166@pitt.edu. And I will go ahead and look at what questions we have in the chat box. I think Carolyn was actually answering several of them already, but I will read them out in case anybody else wanted to hear those answers and didn't see them, or if anybody had anything else to add. So there were a couple people asking about clarifying advanced level 1 and advanced level 2. And Carolyn said that advanced 1 is at the master's level and advanced 2 is at the doctoral level, but entry level should be reiterated across all levels. There was another question about, is there a recommended balance in terms of competencies or sub-competencies depending on the level of the course? And the answer in the chat box was, we try not to overlap too much to make each course stand true to its objectives. This is really dependent on your course objectives, but should not be too limited or too broad. And there were several questions about where to get those matrices that you were all showing. and it sounded like in the publication, but also you could send an email to NCHEC to request the matrices. And let me see if we've had any other questions come in now. My question is related to back-end processes related to eligibility for the CHES exam. We are in a good position to map the competencies to our curriculum, but we have limited funding for mentioned accreditation. If our programs map successfully, how can we market to students they are eligible? It looks as though they would have to go through a transcript review or approval. I am trying to close the gap after degree conferral to seamless exam eligibility. Does anybody have an answer to that question?
This is Anna. At our university, we don't pay for students to take the CHES exam. I would love to be able to do that. So I don't know if that's specifically what you're talking about, but what we do is throughout our program, our students are aware that after they complete the majority of the coursework, they're eligible to sit for the CHES exam. I serve as an ambassador for CHES as well with our students, so I hold regular meetings where I share information about the credential and how to register and take the test and prepare for it. The other thing that you can do is, really if your curriculum is mapped, the transcript review is great, I think, for students because then once they're approved, what they paid goes to their exam registration. So it's just a helpful process, but if your curriculum is mapped, it's very clear that they'll be eligible for the test. So maybe giving them a timeline for when would be the best time for them to actually register and take the exam, and then offering prep, kind of study sessions or reviews would be another way to encourage students to register and take the exam.
All right. Thank you. And it looks, I'm not seeing any other questions in the chat right now. But if anybody has them, we have a couple of minutes left in the session if you have any other questions to answer or to get answered from our speakers today. All right. Well, do any of our panelists then, do you have any other closing remarks or anything else that you would like to answer at this time, or any other comments? If not, it looks like there are no other questions, so we can wrap up. Is there an official partnership structure between NCHEC and universities?
There's really no official structure, but we do have ambassadors. I'm also an ambassador as well. And so, most universities with ambassadors know about the mapping process. And as Anna mentioned, if you map out your courses appropriately and that's listed in the syllabi, it would be very easy for the students to then submit their transcripts in to sit for the exam. And that stuff does get noted. So I think that's what many of the panelists, not panelists, but participants are actually concerned about, is whether or not their courses meet the standards. And I think that's the main purpose of this webinar, to make sure that you're appropriately mapping your courses out so that students will know what competencies and sub-competencies are being met. And so when that student submits their information or transcripts to NCHEC, if NCHEC requires further review, then those syllabi could be sent in as well, and it becomes that much easier for those courses to be approved or to be reviewed in order to be determined whether or not the student can sit for the exam.
Thanks. Someone else has asked, how can programs account for CHES eligibility requirements regarding process and content credit hours? If content hours are electives, what strategies can be used to make sure that all competencies are met if not all students take the same classes?
Okay, this is Carolyn again. We ran into an issue like that as well. One of the things we did for our courses at Governor State was to include selectives. So we initially had electives because we do have a large population of students who enroll into our pre-OT program, but also want to sit for the CHES examination. And so what we did, instead of allowing them to choose electives, we chose selectives. And all of those selective courses were courses that had been mapped out and that we thought would be approved according to the mapping process for NCHEC. And the students then chose those selectives as their electives to choose from if they wanted to then sit for the CHES examination. And that's just one of the ways that we strategize to still make those students have the opportunity to then apply and sit for the CHES examination.
Thank you. All right, that was the last question I saw. So feel free to put anything else in the chat box that you might want to have answered. I'll give it a minute or so, and then otherwise I think we can wrap up for today. So the evaluation to claim your credit from our session should automatically open whenever you exit out of this WebEx session, but my colleague Tessa will also put the link to it in the chat box should you be concerned about it not opening or if you have a pop-up blocker of any sort at your institution. But typically for everybody it does open automatically. All right, so I'm seeing no other questions, so I'll go ahead and wrap up unless anyone else on our panel would like to unmute with any other comments. Okay. Thank you all very much for coming, and I hope you all have an excellent day. But I guess we're finished up for today. It looks like lots of thank yous in the chat box. And you should see that link to the course evaluation for today as well. Looks like we had one last quick question. Somebody stated, we had just finished mapping our courses when HESPA 2020 came out. Now we need to include ethics and leadership. Can any of you provide examples of how you incorporated those into your curriculum?
This is Carolyn. We actually created a leadership course, and within that leadership course, we included ethics, but we've also have always had ethics spread out through all of our courses in general. But this time around, we actually created a leadership course, and like I said, we bundled most of the ethics information into the leadership course, but for a lot of our other courses, leadership has also, I'm sorry, not leadership, but ethics has been spread out through those courses as well. So that's kind of how we did it. We were a little bit ahead of the game because I'm not sure if many of the other universities and colleges have separate leaderships, which I think most do, but that's what we did. And I hope that answers your question.
Thanks. All right, so I think now I'm not seeing any other questions. The link to the evaluation for the session will open up automatically when you exit out of WebEx, but my colleague Tessa is also putting the link in the chat box as well. There is one more question. We have a class called Foundations of Health Education and Promotion Practice designed to include advocacy, communication, resource person, and ethics and professionalism. I included the topic prior to HESPA 2 because the instructor thought it was important. Okay, so that sounds like just a comment, not a question. Okay, so now I'm seeing no other questions, so I'll go ahead and close out the session in about 30 seconds or so, and everyone's welcome to exit out.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.